What I'd like to do is just try and give two examples of the way in which the Immuno-informatics branch is trying to extend and develop some of the work that can be done by the Becker. So within the Becker, there are people who are very strong at understanding the fundamental mechanisms of immunology at a cellular level, at a tissue level. But the immune system, we know, functions at the level of population. It interacts with the environment. So what we're interested in doing is see how can we bring some of that data in. So as a first example, I'd like to just mention the Greater Manchester Care Record, which is a data set which is generated from integrating healthcare data from across 2.8 million people in Greater Manchester, which is being used to support healthcare in Greater Manchester. But we have research ethics permission to be able to use some of this data for research. So the type of work that we can do with this are, for example, looking at the impact of COVID infection on people who also suffer from type 2 diabetes. So looking at some of the interactions between infection and underlying comorbidities. It's also been useful to look at impact of health inequalities. So to look at the COVID vaccination rollout, but how did that play out against a background of health inequality? And papers now coming out showing the way in which the COVID rollout has actually exacerbated some of the health inequalities that were already present when we looked at data for things like flu vaccination. The second area where we're interested in generating data sets is around the environment. So we're part of something called the NERC Data Hub. And what the NERC Data Hub does is it's integrating large-scale data holdings from the Environmental Research Council around things like air quality, around things like atmospheric conditions, pollution, so all sort of the classic environmental data. And we are now able to ask questions around the way in which environmental data is interacting with some of the healthcare data. So we're beginning to be able to disentangle some of the ways that things like air pollution impact on immune status.